This video will help you recognize bleeding disorders in women and girls. It was developed with a multidisciplinary group of experts. Bleeding disorders occur as often in women as in men. However, women experience the additional bleeding challenges of menstruation and childbirth. Heavy menstrual bleeding in particular can have a major impact on quality of life and social participation. Bleeding symptoms can be caused by a variety of disorders in platelets and blood clotting factors. Von Willebrand's disease is the most common inherited bleeding disorder, but haemophilia carriership and platelet defects can cause bleeding symptoms in women too. Because most bleeding disorders are hereditary diseases, it's imperative to be aware of and regularly update the family history from childhood onwards to avoid missing new cases. As a child, common symptoms include nosebleeds, easy bruising, and excessive bleeding from minor wounds. Adolescent girls can also have prolonged or excessive bleeding after dental extractions. However, heavy menstrual bleeding is a key and sometimes the only sign of a bleeding disorder in adolescence. Particularly when starting at menarche, it should raise suspicion. In adulthood, heavy menstrual bleeding may worsen when women approach menopause. Bleeding problems can also become apparent around childbirth and during ovulation. Surgery can also result in prolonged or excessive bleeding, sometimes even requiring blood transfusion. In late adulthood, women sometimes face spontaneous bleeding from the gastrointestinal tract or unexpected bleeding after surgery. Assessing the personal bleeding history and family history are key to identifying women who are likely to have undiagnosed bleeding disorders. Be especially aware of this possibility in women with multiple bleeding symptoms and/or a positive family history. If you do suspect a bleeding disorder, the next steps are to start initial treatment and consult a hematologist for diagnostic laboratory assessment. Thank you for watching.